Welcome to another episode of Preparing for the Unexpected. I'm your host, Alex Fullick, and as always, we like to talk about things related to COVID, business continuity, well-being, emergency management, crisis management, anything that helps you, your organization, or your community prepare for, respond to, and overcome adverse situations. If you'd like to be a guest on the show, please feel free. You can reach out and find me on LinkedIn. I'm the only Alex Fullick there, so I'm really easy to find, and I do respond to everything I get. Alternatively, if you want, you can go to alexfullick.com and you can reach me that way. It is that time again. I think this will be our 23rd episode, something like that, talking about COVID and everything relatable to it. So I want to welcome back to the show for January 2022, Regina Phelps. Regina, welcome back.
Oh, Alex, it's been so long. I think we must have did our last gig in early December because it seems like, oh my gosh, it's been months since I spoke to you, even though I know that's not true.
Well, we've had Christmas and holidays, and you've had
your Omicron
Omicron, yes, which luckily or unluckily for me was discovered on my birthday, November 8th. But we've had so much happen since then, So I know there's lots for us to touch on today. But how are you doing otherwise?
So far, so good. Knock on wood. I have not gotten Omicron or any of the other variants. But boy, everybody around me in a highly vaccinated city, 85% of our population is vaccinated, and that includes all ages, which means that's counting kids that can't even be vaccinated. And yet we still have widespread illness. So,
yeah, we've been experiencing the same thing here in the Greater Toronto area, and I'm just outside of it. But we've had the same thing. We had tens of thousands of cases reported, in one day at one point. Mm-hmm. And I'll go through some of the latest stats, in a few moments. But yeah, we were in the same thing. It just kind of exploded. Mm-hmm. There really is no other word for it. It just exploded, right. And everyone got it. And as I mentioned before we started recording, I'm not sure, but I think I even caught something myself, and you can probably still hear just a little bit.
Yeah, a little frog in your throat.
Yeah, a little frog in my throat, a little bit stuffiness. I feel completely fine. I didn't experience 90% of the symptoms of COVID or Omicron. Just a seasonal cold, a nagging cold, and that was it. I wasn't even sneezing.
And that could have been what you had too, right? I mean,
yeah, it could have been. I did, for everyone who's listening, I did isolate at home anyway, just in case, because I wasn't going to take any chances. Right. Luckily, I'd gone grocery shopping beforehand, so the house was full, didn't have to worry, stayed home, and that was a couple of weeks ago, and I feel fine except for the little stuffiness that keeps happening, but that's the weather at this time of year. So
yeah.
And as I mentioned, my neighbor has tested positive for COVID, and my dog walker tested positive for COVID recently. So hopefully they are feeling better in the next couple of days.
Mm-hmm. Mm-hmm. Yeah, well, we have lots to talk about. So as usual, I'd like to start with maybe a deck of slides, if you don't mind. Sure. That would just be helpful for us to be sort of organized. And I think what I wanted our theme to be about today is really about the issue, or are we at a crossroads? And I think you and I were speaking before we began recording that indeed many talking heads are saying, at least here in the United States, this is going to make this an endemic disease, and we're probably, home free. And of course, I'm going to be the one that says that's not the case. But I think a lot of people do feel like we're at the crossroads. And frankly, we're approaching the second anniversary of when it became knowledgeable to most people. And I don't know about you, Alex, but some days I'm just exhausted as we drone on, right?
Yeah, I don't want to hear about COVID. Some days it's like, enough, just enough.
I totally agree. So as we always do, I want to just start with where we are right now. And I'm going to talk about the US and the world, and you're going to cover Canada. Where we are right now here in the United States, this is the map of the United States today. And of course, as you probably would guess by looking at it, the darker the color, the more cases one has. And as you can see, pretty much the entire United States is lit up completely, with the exception of Maine, who actually had a significant Delta surge, which probably also had some Omicron in it towards the end of last year, which just created huge issues in Maine, your neighbor, one of your close neighbors. And consequently, they are still in recovery from that. And they're actually the only part of the United States that's actually doing pretty well. Here is our mapping as of today. So today is January 24th. Our cases are dropping exponentially, just as they rose exponentially. And you can see that graph. It's pretty humbling. Our tests are still going up and down, but our hospitalizations are still very high. We're at 156,000, the highest we've ever had hospitalized in the United States. And now some of those people, probably about 20% of them, were actually admitted to the hospital for something else, and they actually found they had COVID. So maybe they were going in for a surgery, or maybe they'd been in a car accident, or they'd had a heart attack. And when they were admitted, of course, they test everyone, and they were actually positive for COVID. But they may not be having COVID-related symptoms, let's say, but having a COVID patient then puts them into a whole nother realm of issues, such as isolation and more staffing requirements, more PPE and all of that. So it makes it much more difficult for the hospital, even if the person that's in the hospital is not actually there because of COVID. So it's still an issue. And then our deaths are still going up. We almost hit 4,000 deaths on Friday. And that's, in a day. And now deaths are a real significant lagging indicator, and many states are often days, if not weeks, before they report them. So that kind of dribs and drabs. So we can expect our death toll probably to remain high for the next 30 days, even as cases are dropping significantly. And at some point, hospitalizations will begin to decline. So that's kind of where we are. And speaking of hospitalizations, this particular map shows you where a lot of that's going on. So in my state, for example, we have lots of cases in California. We have lots of people in the hospital, but by compared to many other parts of the country, we are, kind of minor in many ways, even though we're the largest state with 44 million people. And so as you can see, a good part of the more unvaccinated states are really suffering from a lot of hospitalizations here in the US. And if you're not listening to this on the radio, you're not going to be able to see this map, but you can see places such as Florida and Texas and New Mexico and many other states in the South. So Louisiana, Mississippi, Alabama, Georgia, et cetera, all having a significant amount of hospitalizations. Which then makes you ask the question, well, okay, so what's happening with vaccinated versus unvaccinated people? And this particular slide, the top part of it actually shows you the daily cases between the unvaccinated and the fully vaccinated. And as you can see on this particular graph, it shows you that fully vaccinated people, which means they are not boosted, fully vaccinated still by the definition of the CDC is 2 doses, they're really kicking up there, right? Where they're having more and more breakthrough cases. But the unvaccinated are still substantially higher, about 20 times higher than the fully vaccinated folks. And the death rate is substantial. So you're about 20 times more likely to die if you're unvaccinated compared to those that are fully vaccinated. As you can see on this graph, the fully vaccinated people that have actually died, it's a really small number. And the things that they have in common are that they're generally older, over the age of 70, and they have a variety of comorbidities. And that also really speaks to the hospitalizations. So if you look at the bottom part of the slide, you'll see that hospitalizations are starting to tick down, but they're most prevalent in individuals who are over 70. And they're also the next age group, which is between 50 and 60, 60 and 70. Those age groups are having more hospitalizations. And we're having more kids. Are you having more kids actually being hospitalized in Canada? Do you know?
I'm not seeing a big number of kids, because one of my updates, I'll tell you, the 5 years old and up, there's a high percentage of them that are getting vaccinated.
Right. You're doing much, much, much better than we are. Our vaccination status for that age group between 5 and 11 is about 20%, which is awful.
Yeah, we're much, much higher than that.
Yeah. Yeah. You're very fortunate.
If you go back that slide to the slide here, you mentioned the 70-year-olds, 60, 70-year-olds being the most impacted right now. Correct me if I'm wrong, wasn't that the way the first wave went?
Yes.
With the pandemic as well?
Yeah.
Was that age group?
Yep. And part of that is that certainly the older you are, it's more likely that you have more comorbidities, right? Secondarily, in older people, there's something called immunosenescence, which means that your immune system isn't quite as perky, as reactive as it is for a younger person. So even if you've had 2 doses, or even maybe in some cases 3, if you're older, the combination of the comorbidities that you may have, as well as the fact that your immune system does not snap up like somebody who's younger, makes a huge difference.
Okay.
So as you get older, it becomes more of a challenge, and not just for COVID. Any other infectious disease presents the similar problem, like the flu, for example. Here in the United States, we have a lot more kids who are being hospitalized, and certainly a lot of that's because we just have so many infections. Kids that are under, between 0 and 4, there's no vaccine yet for them. And so there's really been a big uptick in those kids being hospitalized. And also the kids that are 5 to 17, which again, as I mentioned, we're just having a really poor number of kids being vaccinated. In the age group from 5 to 11, I think it's 20%. And I think in the age group from 12 to 17, it's somewhere around 50, but it should be much higher. Omicron, which of course is our new variant and the one that's really taking over the world, as you can see, this is actually from the Economist, showing you that it is the virus that's really taking over the world. We don't know much about what's going on in a good part of Africa because a lot of genetic sequencing is not done in most countries in Africa. South Africa is very sophisticated, and so they do have a really good understanding of what their penetration is with Omicron. Everybody else, not so much. China is reporting, of course, Omicron cases. They have several thousand, but they're not really saying much about data, as you probably are very familiar with. And so it is the variant of concern. And this is actually a slide that I really like, this particular site. It's called Next Strain. And there are scientists all over the world that upload their genetic sequences to this. So you can really see in real time what's actually going on with the virus. And for those listeners that are watching this on YouTube, there's a large cluster of very turquoise dots at the very top of this Next Strain slide. And that's our old friend, Delta. And you could see that at one point, almost all the cases, pretty much all over the world, were Delta. But then once Omicron began to take hold in many places around the world, you can see that Omicron is taking over. And now, instead of being a lot of Delta, we're seeing little snippets of Delta here and there, but we are seeing lots of Omicron, which gets to the fact that there are 2 colors there. And I want to just show you, that's what the big chunk of Omicron looks like on this Next Strain website. And as you can see, almost all of it is a really dark orange, but down the lower right-hand side is this emergence of a gold little circle. And that is the variant known as B2, BA.2. And that's the one that we had talked about briefly. It's called the stealth variant, which is kind of a creepy name. And essentially it's called that for really one specific reason. And that is because it eludes some PCR tests. And so because of that, in areas that are using certain brands of PCR equipment, they may not be able actually to identify it clearly. And that's one of the reasons it's called a stealth variant. So that's one thing. Secondarily, there is some discussion that it may be even more infectious than the original, which is now titled BA.1. That's the original variant. There are actually 3 variants of Omicron, actually 2, with one being the primary one. So we do know that there are now 2 variants of the main Omicron. So there's a BA.2 and a BA.3. BA.2 is the stealth variant. It is thought to be somewhat maybe more infectious than Omicron, which is a lot to say. And this particular variant has been found in the US. It's been found in India. It's been found in Europe. It's in the UK. So you can imagine that it will pretty much be everywhere. Now, as to whether it's really a big threat for us beyond Omicron in general, that's we'll need to see how that plays out. If it's a little bit more infectious, perhaps not. If it's a lot more infectious, then that could be a bigger issue.
And I do want a bigger issue because it's not as easily detectable.
Right. Exactly. And so that's a problem in general. One of the nice things about the original Omicron is that there was actually a PCR test that for most PCR tests, there are different light channels that light up. But when this particular variant became prevalent, instead of 3 light channels lighting up, there was something called a S gene dropout, and only 2 channels could light up. So on a PCR test, they could almost automatically tell it was Omicron because of this kind of a little nuance in the variant. But in this one particular one, it eludes a lot of PCR tests in general. I'll just talk about one more thing, and then I don't know if you want to keep going or if you want to stop. But I do want to. People are often saying, "Well, look at South Africa to determine what your impact of Omicron is going to be in your country." Now, even though it is thought to be milder, okay, so it's affecting more of the upper airways than the lower parts of the lungs, so that is helpful. That means that it doesn't necessarily cause as severe a pneumonia. But cases in South Africa are 16 times higher than they were before the Omicron surge. Today, even though it's really going down, the numbers are really going down, hospitalizations are still 6 times higher and deaths are 6 times higher. So even if the disease is milder, meaning it causes less serious illness, there are so many cases just by the numbers game, you're going to have more deaths and more hospitalizations. And that's occurring worldwide.
Mm-hmm. I'm seeing that, that's happening here. I've had that conversation here in Canada.
Do you want to talk about Canada, or do you want to stop?
I'll give a quick update on what's happening here in Canada. Then we'll take our first break.
Okay,
so
great.
I pulled out the website just to make sure I had everything, the latest here, because it was updated, I believe, this morning.
And you have a really great website. The Ontario website in particular, I think, is fabulous for your area.
Yeah, there is an interesting one. I'm taking a look at cbc.ca, which is a news website that links all the different provinces together and consolidates everything. So I'm taking a look at that. So in Canada in the last week, we've had 180,121 new cases, which is actually a decrease of 28%.
Wow.
Active cases, the number of active cases declined by 23%. However, and you just mentioned this too, deaths have increased to, what was it, in the last week, 1,030 deaths, or 2.7 per 100,000 people, an increase of 70%.
Yeah, that's a lot for you.
And hospitalizations rose 15%, and ICU beds filled rose up by 14%.
Wow.
So
those are big numbers for you, for Canada.
Yeah. Well, like you said, that even though some of the numbers are coming down on one side, the deaths, and the long-term part is still happening. So there's still an increase with deaths there. With vaccinations, percentage of people given at least one dose, we're at 84%. And fully vaccinated, which is just the 2 doses, I'm not talking about the boosters, we're at 78%. And the last number I did see, if I include boosters for everybody that is eligible for a 3rd dose, we're around 46% already. So
Wow.
that's gotten large. And 5-year-olds plus, the second dose is, when you incorporate that age group, we're at 81%. So in some spots, we are just going way up. And in others, it's good to see some cases and things like that coming down. So
I'm jealous, Alex. I'm jealous.
Well, it's like I said, I want to be optimistic, but we've been in the same situation 3 times already.
Right.
So, unless something happens in a few more weeks, maybe another month or 2 yet, then maybe I'll start being, optimistic. But right now it's no, been here before. Yep. I'm not going to get my hopes up again.
Yeah, I'm with you on that one.
But I did want to mention something else too that's happening. No, you know what? I'll save this. I'll save it for later in our talk here.
Okay.
We're talking with Regina Phelps, the latest on Omicron and COVID and other variants that are out there. We're talking with Regina Phelps, and we'll be right back. Welcome back. We're talking with Regina Phelps today about all things COVID related. Regina, any update you want to give on the world overall?
Yeah, so let's just really quickly talk about that. Omicron is doing quite a significant impact across the world. Certainly in Europe, you're seeing still some countries being locked down, even places like Austria now actually promoting and talking about having a mandated vaccine for all residents. There's a lot more restrictions that are happening. France, I think yesterday, recorded the biggest number of cases they've ever had. And they're also looking at vaccine passports for almost any activity in that country. Also, Omicron is starting to take off in India, and it's also their religious season. So there's a lot of concern that maybe there could be an opportunity for it to really take off like Delta did originally last year at this same time. So there's a lot going on around the world. One of the things that as we mentioned earlier, is that whenever you have a lot of cases, there's going to be much more illness, much more hospitalizations, and unfortunately more deaths. And I think the big concern globally is what this means to healthcare workers in general. And we'll talk more about that towards the end of our talk today. But there's a lot going on globally. And I encourage all of your listeners to really follow your country's information, because there's a lot of changes and issues going on worldwide. But yeah, that's kind of where we are. It's a big issue. And to that end, I want to talk briefly for a moment about China. Of course, the Olympics are around the corner here. And so, as you know, China's continuing to have a zero COVID strategy. And I think it will be fascinating to see what happens post-Olympics. The reason this is actually a big deal that everybody around the world is impacted by is because simply the incredible, massive role that China has in global commerce. And so when you think of shipping and you think of manufacturing, you may say to yourself, well, I don't care if China has a zero COVID strategy. Well, if they're locking down cities like Xi'an for 3 or 4 weeks, and there's 15 million people there, and they do a lot of manufacturing, this could impact many countries. I mean, here in the United States, and I'm sure in Canada as well, there are gigantic supply chain issues, whether it's global chips, or whether it's, you bought a couch and you paid for it 7 months ago and you still haven't gotten it. There are lots of issues related to the global supply chain. So all of us that are continuity planners and crisis managers, whatever China is doing in relationship to this zero COVID strategy has a huge impact. So it'll be curious post-Olympics as to whether they will continue that strategy or not. And so that will be something that we'll see over time. And the last thing I really want to say globally is what is the actual real death toll of the pandemic? Yes, we do have an official death toll, as you see from seeing Johns Hopkins website, for example, every day. It's now about 5.6 million people. Well, I think all of us actually know that that's not even remotely what the actual number is. There are many countries that have a zero as listed as deaths because they don't track them. Either because they don't even track regular deaths on an ongoing basis, but it's just a big vacuum. And so there's a lot of statisticians and economists that try and figure out, well, what is the real death toll? So The Economist, the magazine produced out of the UK, actually has been trying to get their arms around this. And they started publishing this about 18 months ago, trying to understand what the real death toll is. So the official death toll, as I mentioned, is 5.6 million. They believe by looking at excess deaths, which means if you look at most countries and you have the average death per year, then you can extrapolate that looking at age and population and so on. They believe that the real death toll of the pandemic is probably somewhere around 19.6 million people. So literally about 3.5 times larger than the official death toll. And so it's important to really understand that there is a lot that we don't really know. And when I started studying pandemics in the late 90s, I used to say to myself, well, how is it that you don't know who died from the pandemic? But it's complicated. And there are also people that might have been in a car accident and they were taken to the hospital and then they ended up getting COVID. So did they die of the car accident or did they die of COVID? Or maybe, there are cases of where people actually have lots of comorbidities and COVID was the last thing. So did they die of COVID or did they die of their diabetes? And so there's a lot of difficulty in actually trying to assess what the real death toll is, even though it sounds kind of odd. When you start to peel it back, it's actually complicated.
Yeah, definitely.
Yeah.
One thing I just wanted to add about the world is here in Canada, the province of Quebec actually proposed, I'm not sure where this stands yet, but taxing those that will not get vaccinated.
Really?
Yeah.
Wow.
There's a big hubbub about it, but I haven't seen any final decision yet. Because I think the talk is still going on. As of today, in the province of Quebec, you need a vaccine passport to be able to shop in the big box stores.
Wow.
So stores that have 1,500 square feet or more. So we're talking the Walmarts, the Costco's, up here in Canada, stores like Canadian Tire. If you don't have a vaccine passport, you can't go in there.
Wow. Wow. So, yeah, we'll never get that here in the United States.
What they're seeing, though, to add, the positive side of that is that the unvaccinated and the appointments are all going up. The unvaccinated people are starting to finally get the hint that they need to take their shots, and the bookings are going up.
I had seen in Quebec that you can't go into a liquor store unless you have a vaccine passport.
That's true. Yeah.
And what they were talking about when they released that information last week is that they had seen a huge uptake in vaccines the day that was official. And I thought, well, it's one way to get to people. You can't get your wine or your beer or your alcohol or whatever, right?
Yep. And in Ontario, they were actually using liquor stores to hand out the rapid tests at one point. So targeting people, right? In the right spots.
Whatever works, baby. Whatever works.
Exactly.
Well, I thought it'd be just good to talk about, what's our future? You and I've talked about this a zillion times, right? There's a million things that could go wrong. And some of the negative things that could really impact us would be a variant that eludes PCR testing. Gee, didn't we just talk about that with this stealth Omicron variant? If it eludes PCR testing, that becomes problematic. These are all things that could happen. We could have even one that's more contagious than Omicron, which we thought would be amazing with Delta, and look at where we are now. It could be something that reinfects those people who've already been infected. Well, my goodness, Omicron does that, but that could happen to us again. Something that eludes vaccines, and we're seeing that already with waning immunity, something that could be more deadly. That's the only thing we haven't had happen. And one that continues this animal crossover issue, which is actually an important thing to stop and think about here for a minute here, Alex, is that increasingly there are more and more mammals who are actually getting SARS-CoV-2. That should make you, and it makes me, frankly, anxious. You've seen that with white-tailed deer here in the United States with hunters. Hamsters, you might have been following what's going on in China, where they're culling lots of pet hamsters because of getting SARS-CoV-2, right? Mink was a big deal in mink farms, both in Canada, but also in Europe and the United States. Lots of zoos are reporting mammals, so all the cats, the lions, pumas, there's been bears, there's been tigers, and that's a big issue. Domestic cats and dogs. And the one that makes me actually the most anxious, to be honest with you, is mice. There was a study since I last spoke with you that was released in December, late December, showing that maybe one of the origins of Omicron was actually mice. It was originally thought, and this is still not clear, it was originally thought it probably came from an immunosuppressed person. There's a lot of HIV in South Africa, and that very likely could have been incubating in somebody for a really long time. But there was 2 studies released at the end of December that said it had been found in mice. And I thought, oh my God, I mean, mice are everywhere. Mm-hmm. And if actually it was reproducing successfully in mice and then mutating and then jumping back to a human, that could be grim. It's also been found in otters. So this is actually
reminds me of was it the bubonic plague in rats?
Yeah, well, yeah, fleas, right, from fleas, right. Yeah. In fact, there were cases in the bubonic plague where they would infect a bunch of rugs and blankets and then give them out to people so they'd get sick. Yeah, pretty awful. So there are some good things that are happening, though, and one of the 2 biggest ones are the 2 oral antivirals that have been approved here in the United States, and they've been approved in a variety of other countries as well. Molnupiravir, which is by Merck, and then Paxlovid, which is by Pfizer. Paxlovid is far more effective here in the United States, so it's in very, very short supply. But it's like 90 to 95% effective of stopping you from your disease from progressing, which means you're not going to go to the hospital and you're not going to die. Molnupiravir by Merck is not as effective, only 30%, but for some people who have a lot of comorbidities or are aged, it could be a game changer. And it's an oral medication, so it can be taken easily. The thing about these antivirals and ones that will come in the future is that there are very short windows where they work. And you need to be taking these generally within 3 to 5 days of your symptoms. So that means that you need to get tested, get the results back, or have a rapid test. You need to get to a physician, and you need to start taking those pills within this time frame. Otherwise, what will happen is they're not going to be as effective. So there's a lot of time constraints here, but these are going to be big, important changes, because that means that very likely you could get sick, but then you have something that's going to stop it from progressing. And that's really important. And I don't know, have these been approved in Canada? Do you know?
I don't think they've been approved. And if they have, I think one was, because I did hear something on the radio just the other day. Mm-hmm. And I forgot I was too busy doing something else that I didn't capture the full explanation that was going on. I think they're under review, but mm-hmm. I believe they are trying to push them through ASAP, mm-hmm. so that they can get these out to market, because there were also reports of people saying that with this, they felt more comfortable now doing something about COVID rather than just sitting at home. But getting a vaccine, and then with this, they feel more comfortable.
Right. It would be a huge, huge game changer. Mm-hmm. And here in the United States, these will be much more widely available, especially the Paxlovid, certainly in the next 6 months. But right now, that one in particular is in short supply. The other thing that's happening, so I saw that Canada is now requiring you to be vaccinated to fly. That is huge. I wish we did that in the United States. That's not the case. There are other EU countries that are talking about vaccine passports for flying, and also just for getting into their country if you're not a citizen. So I think what's going to happen is, between vaccine requirements and other issues related to having a passport that shows your vaccine status, will also begin to become more aggressive in the beginning part of 2022, because people are trying to have some sort of normalcy in their life. And I think people generally understand the only way that's going to really happen is if you're vaccinated. So I think you're going to see, just as you were describing vaccine requirements in Canada, you're certainly seeing much more of them in Europe. And there are certain states in the United States that are also making much more requirements of this. And so I think this is going to really change over time. Here in the United States, so unfortunately, the Supreme Court sort of knocked down Biden's a requirement for employers of over 100 employees to have a vaccine requirement. But healthcare is still required. What's actually been proven in studies, this is from The Economist, is that looking at Canada and looking at Europe, it suggests very clearly that vaccine mandates work. And if you look at these numbers, and again, if you're watching, listening to this on the radio, Germany, France, Italy, and Canada are the ones that The Economists actually show on this particular slide, starting from very high amounts of minimal vaccine. And by the time the mandate started, there was just a huge uptake in vaccine, and where you can see now that literally it had a gigantic impact on the actual vaccine uptake. And your country in particular, as you can see, is the star of these 4 countries that are mentioned.
Doesn't always feel like that.
Yeah, well, come down to your southern neighbor to see what it's like on the other side, my friend. And that, which gets to this side, which says that who is the most vaccine hesitant country in the world? Yeah, it's your southern neighbor. And then after that, it's Britain and Sweden and Germany, Italy, and then you have some vaccine resistance, and then France and Spain. And I have to tell you, I do a lot of work in South America, and I do a lot of work in Africa. And my clients there think, of course, that we're nuts here in the United States. And they always say to me, Regina, is that you in the United States haven't really had to deal with infectious disease like we have in our country, and therefore you don't really remember what it's like before there was a vaccine. And I think that that's really true, is that we have become very jaded, whether it's measles or mumps or polio or whatever. We just don't seem to remember what it was like to have diseases run rampant. And between that and misinformation here in the United States, it's a huge, huge problem.
Yeah, that's an interesting point. It's almost as though we take it for granted. We'll be fine.
We'll be fine, right? We don't have that memory. We don't have the memory. That's right.
Yeah.
And so I want to talk just briefly. We've talked about this before, talking about whether we're getting to an endemic phase. And I had asked you before we started, are they talking about this up in Canada, right? Is this an endemic yet? And I think the thing that people need to understand is that there's not a line in the sand where we cross and all of a sudden we're going to be in the endemic space. But it will happen over time. So I'm not sure where we are. I forgot to set my timer. Do we need to stop?
Well, why don't we take a break now, and then we'll come back and we'll talk about the last couple of things we've got. We're talking once again with Regina Phelps about all things COVID, and we'll be right back. Welcome back. We're talking with Regina Phelps once again, all things COVID. Regina, I think the last thing we were going to talk about now is the long tail of COVID, I think.
Yeah, actually, I do want to just quickly talk for a moment about the endemic issue, just because there isn't a line in the sand. And if they're talking about this in Canada as well, the definitions really of an endemic, and this is important to understand, and it's at the bottom of the slide, is that means that the infection is at a constantly maintained baseline. So it's like just underneath the surface, it's continually happening, but it is not impacting healthcare systems, which of course is not the case anywhere in the world. So we are not endemic, and we're going to be endemic at some point, but who knows when? It really is all about the variants. And the only way that we're going to actually get to be endemic is really all the things that we already know: vaccine, 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 vaccine. But also because we are still in the winter months here in the Northern Hemisphere, we need to be still thinking about ventilation. We still need to be having masking. I mean, in my town, everybody's masked up completely. We still have to be doing hand washing, and we have to be really, for those who have their hands on home tests, if you're not feeling well, you need to be checking yourself and testing. That's how we're going to contain this. And I know we've been saying the same darn thing for 2 years now, but it's true. And that's what's going to get us to an endemic state. And so I know there are pundits that are saying that we are already there. And I will say to you that that is not the case at all. And this was a great quote by one of the WHO epidemiologists, who said that when things become endemic, it does not mean that it is not, it is benign. I mean, it can still be a significant illness. And so the chances are maybe by the end of 2022, we could actually get to where it's more manageable worldwide. But that's going to really depend on vaccines being administered across the globe, which is another complicated problem. There are vaccines being delivered, but then they don't have the resources or the wherewithal, the syringes, the needles, the staff to get them in people's arms. So a vaccine has to become a vaccination to actually stop the pandemic. And lastly, I'd like to really talk about the long tail of COVID. You and I've talked about this before, but it is a huge issue. COVID, as just to remind everybody, is an aerosol illness. We all know that, but it affects every ACE2 receptor in the body, which is almost, frankly, every part of your internal organs. So it's all of your oral mucosa in your nose, all the way down into your lungs, but it's also your heart, your blood vessels, your kidneys, your brain, all of your nerves, your gastrointestinal system. And so this is where, in particular, when people say it's just a respiratory illness, it is not that at all. It can affect any of these organs. I just read this morning of a journal of gastroenterology where they were talking about a 11-year-old girl who had COVID, and if she was PCR tested positive, she'd started having a lot of gastrointestinal pain every time she ate. They worked her up and worked her up and worked her up. They gave her all kinds of treatments. Nothing seemed to help. They finally did a colonoscopy and kind of an exploration of her colon, and they discovered that she had large pockets in her colon that were like encapsulated SARS-CoV-2. That she could not shed the infection, and it was encapsulated in her intestines. It's like, oh my God. And she had long COVID, and it was all of these encapsulated little pockets of SARS-CoV-2. Amazing. I think the thing that I frankly am the most concerned about when I think of SARS-CoV-2 or the COVID pandemic is long COVID. You and I've talked about this many times. There's a lot of research being done on this. There's still a lot that is completely unknown. There's about a 10% chance of anybody who gets COVID that they'll actually have long COVID. And if you're over the age of 70, that jumps to about 22%. That's a huge deal. There's lots of orphaned kids. We talked about this last time, 1.6 million now globally. And in the United States, there's 130,000 people who have lost their primary caregivers. That's either both parents or grandparents who took care of them. I don't know about you, but one of my biggest concerns is what's happening to the healthcare system. Here in the United States, we don't have a unified healthcare system like you do in Canada. And we are having huge issues with just so many people quitting working. Nurses, physicians, respiratory therapists, aides, LVNs. And that's going to have an impact for us for years to come. And there's also a lot of missed global health goals that have been missed around the world. Polio vaccines being administered globally, measles, mumps, rubella, many things like that that are going to have a big impact to the healthcare around the world. Mental health challenges. There's so much discussion about that here in the United States. I'll be curious. Are you talking a lot about mental health in Canada with the long tail of the pandemic?
Yeah, mental health and well-being is everywhere right now. Mm-hmm. Everyone is talking about it, mm-hmm. and rightly so.
Mm-hmm. Yeah, it's such a problem, and for people of all ages. But what they're discovering here in the U.S. is that kids, in particular, adolescents, are really suffering from either not being in school or not being able to see their colleagues and friends, and it's a huge problem. So I think just that alone globally is going to create a really long tail where the pandemic may stop, but we're going to have these mental health challenges in many cases for a very, very long time. Of course, disrupted economies. There's been a huge increase in drug and alcohol use. And I just read a whole piece about gambling, that there are a lot of people that can gamble online now, and the pandemic has sort of drove them into this activity. And it's one of those silent addictions that disrupts families and their incomes. And, that's just another example of people's coping mechanisms not always being the most positive. Supply chain disruptions, we talked about that earlier, and the impact that has on economies. And I think one of the things we've talked a lot about is the changed workforce, but also the transformed workplace. And here in the United States, what's happening is that a lot of people are not still back at work. And that really changed with the Omicron variant. And I also think that employees are now thinking much differently about what they want from an employer. Mm-hmm. They want remote work. They want more flexibility. And the younger they are, the more they're asking for that. And if they're not getting it, they're very willing to walk. And I think because of the workforce shortages we're seeing here in the US, at least I'd be curious about Canada, that means that people can leave one job and pretty quickly find another. And so I think another long tail of this is the transformation permanently of many workplaces and expectations of employees for their employer, how they're treated and what's expected. So I think that's a real shift. What's happening in that area in Canada?
Well, it's interesting you just mentioned the employee shift. In Canada, we now have a law of, I forgot its exact name, but you're allowed now to disconnect, and your employer cannot just reach out and start expecting you to do things in the evening anymore.
Wow.
If your role is something along the lines, you're a first responder, that's a little bit different. Mm-hmm. But you can no longer be reprimanded or punished by an employer if you don't respond to an email that gets sent at 7:30 at night. You can wait. You do not have to respond. And if you are reprimanded at all, it's now you can be fined. The organization can be fined for doing that.
That's brilliant.
And I've seen that happen, starting to happen in a few other countries. I think Western European countries, a couple of them are talking about doing the same thing. Mm-hmm. And it's great because with people working from home, they're working longer.
Right.
And the 4-day work week now is starting to pick up steam, and the support for that. And I think it's Norway or Sweden or Denmark, somewhere in there, they've adopted the 4-day work week.
Mm-hmm. That's
seems
great.
to be working quite well. So
yeah, I mean, and to have actually 3 days you can disconnect from your employer is great. And I love the idea, frankly, of where there is some responsibilities being placed on an employer about asking people to do things beyond what the agreed upon hours are. Now, if you work with your manager and you change your hours to be, okay, I work from 3 to 11 every day, great. Well, I'm happy to respond to you during my time. But other than that, I am not working. And I think that's going to be increasingly important as we continue this remote process.
Yeah. And on that note, we've come to the end of the show this month, Regina. There was you even told us a little bit of positive news in there. So I'm going to take that as a good sign in itself, that after 23 episodes where we've just focused on Omicron, that we finally have a little bit of good news thrown in there, just a little bit, but
hallelujah.
Better than
what happens next month, right?
Yeah, hopefully it's better.
Oh, please.
Regina, thanks very much again. It's always a pleasure to chat with you and share time. We have great conversations off camera. Sometimes I wish everyone could hear those, but oh well.
Ditto, Alex. It's always great to be with you. Thanks again for the invitation.
Oh, always my pleasure. And to everybody watching and listening, stay prepared, everybody.
If you liked that video, thumbs up. If you didn't like that video, thumbs down. But leave a message and let me know what your thoughts are. If you'd like to be a guest on the show to talk about something related to business continuity, disaster management, COVID, personal well-being, anything that's relatable to those subjects, you can reach me through my LinkedIn profile, which is in the video description. And of course, don't forget to subscribe. In the meantime, stay prepared, everybody.